radiograph that from an anterior-posterior position. So what we're going to look at is the long axis of the tooth, the film, the animal's external recumbency, with the film parallel to the heart palate. So the film and the tooth form an angle. So you can use a positioning device such as this, which helps you work out what that angle is. So if we got the long axis of the tooth and the long axis of the film, and we shoot at right angles to the bisecting angle, which is, this is two equilateral triangles here, so this is the bisected angle here, and it forms two equilateral triangles. We shoot at right angles to that bisected angle, which is that's the bisected angle. You'll get a one-to-one image of the tooth on the film. So you can do that, or you can use another tool, which is another positioning tool for your X-ray source. So normally I would start at right angles to the plate, and then I'll drop to about 35 degrees to get a one-to-one image of the canines, both those maxillary canines on the film. So with this tool you can actually use it as an angle guide. So it will tell you, it's set at 55, but that's from the horizontal, so it's about 35 degrees from the vertical. From the vertical, and then we're going to drop to about 45 degrees. Now with this marker here, you can work out what 45 degrees is, and you can rest it on the marker, and that's at 45 degrees. So 45 degrees is a lot lower than you sometimes think it is. And then you'll take a lateral view of the canine. If you're going to do the premolar teeth, you just basically go a little bit further back at that same angle, and then you can shoot the premolar teeth. If you're going to shoot the molar teeth, the same sort of angle, but because the molar teeth are going palatally a little bit, you're going to change your horizontal angulation to some extent. So you want to be at right angles to the tooth you're radiographing. So if you're radiographing the premolar 4, you want to be at right angles to that. What I mean by that is you want that in the centre of your beam at right angles to the collimator at that angle. So the errors that you can make is that you are too vertical. So if you're too vertical, you'll be foreshortening the image, so you won't have the true bisected angle, so your tooth image on the plate will be shorter than normal. If you're too horizontal, your image will be elongated, so the image of the tooth on the plate will be elongated. So too horizontal means you have an elongated image, too vertical means you've got a foreshortened image. Thanks. So normally they'll be in dorsal recumbency. We have a little towel under their neck, so it makes their mandible parallel to the tabletop. The film, size 4 film, is inside the mouth. We look at the long axis of the tooth and the long axis of the plate, and that will form an angle, and then we'll come in at right angles to that bisected angle. We use our angle device here, and basically you can go at right angles to the tabletop and then drop it till it's at around 55 from the horizontal or 35 from the vertical, and by doing that and having it at that sort of length, you shouldn't get any cone cut on your size 4 film, and you can take a view of the incisors and the canines from an anterior-posterior position. Taking a lateral view of either the canines or the premolar teeth here, we come in at right angles to the plate. We'll drop it at about 45 degrees using our positioning tool, and we'll take a radiograph of that at 45 degrees, and that will give you a one-to-one image of the canine, a lateral view of the canine and lateral views of the premolar teeth. Have a towel under the animal's neck so that the mandible is parallel to the tabletop, Again, we're going to do a parallel view of the mandibular first molar. So here we have the film inside the lingual sulcus. So it's inside the mouth, the tongue is here, and now we're going to be shooting parallel to the film and the tooth. Parallel. Now, one of the problems you have is that you can't get the film all the way down into the lingual sulcus. So what happens is if you shoot parallel, completely parallel, you'll miss the apices of the roots of the mandibular first molar. So you can still be parallel plus or minus about 15 degrees. So what I do here is you angle up at about 15 degrees and then you take your radiograph. And if you look at that angle, now the X-ray beam is hitting the plate and the tooth is at a higher level, more dorsal along the film. Have a huge zygoma, which interferes with your view of the maxillary fourth premolar tooth in the cat. So the zygoma superimposes over that tooth. So one way of getting around that is, instead of shooting, so you hold it at right angles, instead of shooting at 45 degrees, which usually means that your zygoma will be around the cemento-enamel junction of the tooth, which is where you're trying to look for cervical or tooth resorption lesions. So instead of doing that, you're going to drop it more horizontal. So by dropping it more horizontal, what that does is it moves the zygoma upwards or apically towards the end of the root of the tooth and allows you to visualize the cemento-enamel junction or the cervical area of the tooth. So just by dropping it to about 30 degrees with this little angle device here, this positioning device, you can actually move the zygoma more apically so that you can now visualize the cervical area of the tooth. Opposite buccal rule, and this will separate the mesiobuccal and the mesiopalatal roots. By shooting from the caudal to rostral direction, you'll separate those roots so you can actually visualize the roots separately. If you just shoot at right angles to the upper fourth premolar, those mesial roots will be superimposed over each other. So if you shoot at the same 45-degree angle, but angle at about 30 degrees from the horizontal, so that's at right angles, and then we go to about 30 degrees, still at the 45-degree angle vertically, but now we moved it slightly caudally, so we're shooting from caudal to rostral. That will separate the mesial roots, so the mesiobuccal root will go forward, and the mesiopalatal root will go backwards. So that, in other words, the mesiobuccal root goes mesially or rostrally and the mesiopalatal root goes caudally or distally. So now we can actually separate those roots. Here we have a representation of the three roots of the maxillary fourth premolar. The two mesial roots, the mesiobuccal and mesiopalatal roots, are in line with each other, so it can't really be separated. If our collimator, which is this camera, turns at about 30 degrees to the caudal, you can now start to see the mesiopalatal root, the black cotton bud, appearing. Now, using the slob rule, same lingual, opposite buccal, the palatal root will go in the same direction as the collimator or the camera. So the black cotton bud is the palatal root or mesiopalatal root. The white cotton bud next to it is the mesiobuccal root, and the white cotton bud in the far right is the distal buccal root. As we come back around towards our right angle view of the upper fourth premolar, you can see that the mesiopalatal root now disappears behind the mesiobuccal root.